Alright everyone, let's talk about an important case that comes a lot in any OSCE exam or Plab2 or real life. It comes in my clinic almost every day. That is someone coming requesting for a PSA test or a test for prostate cancer. That's a common presentation. As we discuss every mind map, I always tell you we discuss three angles. First one, what possible story can be and what may be the patient concern. Second angle, we look at what is written in nice CKS guidelines so you can feel confident on the knowledge you have. And then the third step, we share one single piece of mind map that has all in one so you never struggle. Starting with a story that may be a gentleman old in age, above the age of 50, to make it juicy, and he's requesting a test for prostate cancer. When you talk to him, he may be asking for that test commonly in real life because he has someone who is recently diagnosed with cancer. So he may tell you, my friend or my cousin has been recently diagnosed with cancer, or I have read online that people should get tested for prostate cancer. When you talk to him, he is fit and healthy gentleman and he doesn't have any risk factor in the story, for example. And of course, when you ask about concern, it is the main elephant in the room or the main issue. I am worried about prostate cancer because of my friend being diagnosed with that, or my cousin being diagnosed with that, blah blah blah. I may ask you a few questions about the request he has. Doctor, what is that test for? Okay, and what are the causes of high PSA? Or if it is positive, does it mean that I have cancer? And if it is normal, does that mean that I'm not having cancer? And if I have cancer, will there be any treatment for that? Easy questions, we have easy answers for them. Alright, let's go to step number 2, looking at what is written in nice CKS, and that will be clear-cut information. PSA test should be considered in every man who requests for it if he's above the age of 50. Okay, so PSA should be offered to any man above the age of 50 who requests for it. So will I offer PSA test for my gentleman in the previous story? 100% yes, of course. Why? Because the guideline was quite clear. Any man above the age of 50 who would like a PSA test can have it done, but you need to counsel him about what is the benefit of doing it, what is the risk of doing it. So the indication for PSA test, of course, if someone has suspected prostate cancer, but that's not our patient today, because if someone has suspected prostate cancer, it will be easy offering the test. But someone comes with no symptoms at all, no risk factor, but requesting for it, and he's above the age of 50, he can have it as well, and that is the juicy one because I need to counsel him about the test. Yeah. So what else in the guidelines I need to be aware of? That before offering a PSA test, if you are offering a PSA test, the patient should not have ejaculation or vigorous exercise 48 hours before the test, because that can affect the accuracy of the test. And he should not have an active infection, for example, in the last 6 weeks or so, or not had a biopsy in the last 6 weeks or so. You don't need to know about these two because he is fit and healthy gentleman, as I told you. He's not symptomatic, he's not having infection today. But if you will offer it to him, you will tell him that 2 days before the test, please avoid ejaculation, avoid vigorous exercise, because it can affect the accuracy of the test. What else is mentioned in the guidelines I need to be aware of? Benefits of doing the test and risks of doing the test. What is the benefit of doing PSA testing? It can help in early detection, so it can help it to lead to early detecting prostate cancer before even symptoms develop. That is one advantage, of course. Second advantage is early treatment. If we detect prostate cancer early, we can treat it early. Of course, that can facilitate a complete cure. So you need to be honest to the patient that the test has some advantages as well. It has some disadvantages. So you need to be fair. Don't be biased. Do not promote for disadvantages. Do not promote for advantages as well. Give him both of them and then he can decide. Again, what else is written in the guidelines? That if you decide to do a PSA for the test, you may offer the patient a rectal examination to examine the prostate. But if the patient refuses to have the prostate exam, it's up to him. Do not force him to do that, because as you can see, DRE or digital rectal examination is not always necessary, and you can decide to have the test alone. This information is for the patient, so you shouldn't force him to have the examination. If he's happy to go for examination, it is fine. If he says I'm not comfortable to have a back passage examination, you should respect that and move on, because that is given clear as well in the guidelines. Let's see what is written again in nice about the limitations or disadvantages. What are the disadvantages of doing that test? That it can cause some negative or false negative results. False negative results, about 15% of people with a normal PSA test, okay, they may have prostate cancer. So that is usually 1 in 6 or 1 in 7 with normal test may actually have cancer, but the test has missed that finding. So that is the meaning of false negative. False positive, what is the meaning of false positive? 75% of people with a raised test, with a positive test, will not have cancer. So what is the meaning of that? That 3 out of 4 men with a positive test will not have cancer, but the test was false positive. What is the third disadvantage? That it can cause unnecessary investigations. For these 3 out of 4 men, they will need to go for invasive investigations such as biopsy, for example, and they will not come to have cancer. That is the meaning of unnecessary investigations here. You need to be aware of these 3 disadvantages and the previous 2 advantages. This will be your discussion with that gentleman. Unnecessary treatment, you don't need to worry about it. That is for people who are very old, maybe 90 years of age, and if they are diagnosed with cancer, there is no point of treating them, because for these kind of people, they usually die with the cancer. They do not die from the cancer. I hope it does make sense. You don't need to worry about that point, not relevant to your case anyway. You need to know the 3 disadvantages and the 2 advantages, as I told you before. And then if someone, of course, has a positive PSA test, you will refer anyway for 2-week weight cancer pathway, or if someone has a prostate feels malignant on examination. Yeah. Okay, so that is what you need from NICE. Let's look at the mind map. It will be clear cut after you have read this information with me. So patient coming asking for a PSA test, want this PSA. I will start the same as every time. I will ask an open question about presenting complaint. Can I ask you why do you need that test? That is exploring a presenting complaint. Doctor, because my friend has been diagnosed with prostate cancer. I'm really sorry for your friend. How is he doing now? Doctor is doing okay. Then I will start by exploring symptoms of the request. What is that? That is symptoms of prostate problems or prostatism. And for you to know what are the symptoms of prostate, basically prostatism symptoms are urinary symptoms plus rectal dysfunction. For you to know, prostatism means urinary symptoms and rectal dysfunction. Okay, how do I remember them? For me to remember urinary symptoms, I always like to think about them as an event. Imagine someone going to the toilet. He will have some symptoms before going to the toilet. He will have some symptoms during passing the urine. He will have some symptoms after finishing passing the urine. So let's remember them. Before passing urine, what symptoms he can experience? For example, going more often, frequency, hesitancy, being hesitant when passing urine, or waking up at night often to pass urine, nocturia. So ask the patient, Mr. Smith, have you been experiencing any problem with your water habits at all? No, doctor. Yeah, have been experiencing that you may be going more often, for example, any hesitancy with passing urine. And then during, what you can ask about during, for example, poor flow or blood in the urine, or dysuria, difficulty with passing urine. So you can ask him, Mr. Smith, have you been experiencing any pain with passing urine? Have you noticed any blood with passing urine at all? How about after passing urine? What symptoms can happen from prostatism? Dribbling of urine or feeling of incomplete evacuation of the bladder. So you can ask him, Mr. Smith, have you been noticing any dribbling of urine after passing at all? So ask maybe few questions of prostatism. Remember maybe one from before, one from during, one from after, and don't forget to ask about rectal dysfunction, because prostatism or prostate can affect erection. Mr. Smith, sometimes the prostate problems can affect erections. Have you noticed any problem with your erections at all? As simple as that. That would be my first step in that gentleman. Second step, as I do every time, closed-ended questions for differentials and for red flag. Red flag, what is my red flag here? What is the big elephant in the room? Of course, prostate cancer. So I will ask about prostate cancer symptoms. For you to know, prostate cancer symptoms are 3. Blood in the urine, unexpected weight loss, or unexpected back pain. So please ask about that. Have you noticed any blood in the urine? Have you been losing any weight unexpectedly at all? Have you been experiencing any back pain at all? That will be enough. Everything else is ruled out. If he is coming symptomatic, that gentleman is not symptomatic at all. He's only asking for the request for reassurance or for his own curiosity because he's worried about cancer. But let's imagine someone asking for the test because he has frequency or nocturia. What would be my differential for frequency and nocturia? Of course, it will be diabetes or UTI. So if someone is coming with symptoms, my differentials will be asking about symptoms of diabetes, symptoms of UTI such as fever or pain with passing urine. But for that gentleman, just ask prostatism symptoms with cancer symptoms. You are good to go to the third step, which is general well-being or relevant maftosa? Have you been diagnosed with any medical problems at all? Are you taking any medicine on a regular basis at all? Family history. Anyone in the family has been diagnosed with prostate cancer. Why? Because he's worried about prostate cancer. So you need to specify family history of the relevant point here. Don't ask family history of diabetes, for example, or family history of blood pressure or chlamydia. Doesn't make sense. He's worried about prostate cancer, so I am worried about prostate cancer family history. I hope it does make sense. You can ask about, of course, lifestyle, because smoking is a risk factor. You can ask, Mr. Smith, how about your lifestyle? Do you smoke at all? If yes, quantify that because it's a risk factor. You can ask psychosocial, but he's asymptomatic, so you can skip that one. Of course, idea here, you can ask him, what do you know about that test? Because he's asking for PSA. So Mr. Smith, can you tell me how much do you know about that test? Concern. You don't need to ask about concern or expectation because he gave it to you in the first minute. He told you I want PSA. That was the expectation. Concern, he told you because he's worried about cancer. So he gave you the concern. He gave you the expectation. Your job is to address them in the management. Of course, you can offer examination as I told you. You can offer examining the back passage to examine the prostate. He may accept, that's okay. He may refuse, respect that and move on. Start your management, which is the juicy part in that case. It's a counseling management. You need to start by telling the patient, Mr. Smith, I'm aware you are keen to have a prostate specific antigen test, or you are keen to have a prostate blood test. Of course, we'll be happy to offer you that today, but let's discuss together more information about that test so you can decide if you would be happy to go for it or if you would change your mind. So first of all, Mr. Smith, that is called prostate specific antigen, and that is a blood test which is checking a protein produced by the prostate cells. I'm afraid that protein can be produced by the normal prostate cells, and it can be produced by the cancerous prostate cells. And that basically means, Mr. Smith, that that test is inaccurate marker for prostate cancer. Am I making sense so far? No, doctor, or yes, doctor, yeah. So let me tell you, Mr. Smith, what will be the benefits of doing it and what will be the limitations or risks of doing it. Again, guys, everything from guidelines. The benefits of doing that test, Mr. Smith, that yes, it can help us to early detect cancer even before symptoms arise, and as well, it can help us to early treat cancer if it is found, and that can help to complete cure the cancer. Having said that, Mr. Smith, it comes with few limitations as well, or few risks or few disadvantages, that as we mentioned, it's inaccurate test. So it can give us some misleading results. For example, Mr. Smith, 3 out of 4 men or 75 out of 100 men with a positive result, they will not have cancer, but the test was showing high result, and that can cause unnecessary anxiety. It can cause unnecessary investigations such as referral, having a sample from the prostate, and they will not end up having cancer. On the other hand, Mr. Smith, 15 out of 100 men or 1 out of 6 or 1 out of 7 men with a normal test, with a negative test, they may end up having cancer, but the test was not able to pick it up. So guys, this is how to talk about risks. Of course, as I told you before, 3 disadvantages: false positive, false negative, unnecessary investigations. Yeah. What do you think, Mr. Smith, having given you the benefits and the risks of doing it? Would you be happy to go for the test, or would you like to think about it one more time? If he says, yes, doctor, I still would like to go for the test, then you can tell him, of course, Mr. Smith, will be happy to arrange it for you, but just please, 2 days before the test, please avoid any excessive exertion or avoid any ejaculation, because that can as well affect the accuracy of the test. I'll print a leaflet for you about that test. You can read more about it. If you have any questions, you can always call us back for a discussion. As you can see here, what is the indication for PSA for you guys to know? We have read it together from the guidelines. Any man above the age of 50 who requested for it was one of them, or anyone with suspected prostate cancer, but that will come with symptoms, as you can see. So simple case for 12 out of 12, and you should never struggle with that case. Yeah. Again, as you are aware, we have a package of all cases in a mind map similar to that one. If you like to join, you can text me on that number on WhatsApp. It has every case that you ever imagine in the exam. As well, it has access to my private weekly session for management to master the style. As well, it has access to mind maps for SimMan examination and IBS mechanics, and etc, etc. I hope for you the best. Look at the mind map again. You do not have any excuse to score less than 12. Thank you.